Hello and welcome to Occupied Thoughts, a podcast brought to you by the Foundation for Middle East Peace. I'm Lara Friedman. I'm the president of the Foundation for Middle East Peace. Today is December 17th, 2024, and I'm very honored to have with me today two brilliant women, and we're going to be talking about the health apocalypse, which is the term that I am now using, that has been created deliberately in Gaza. So first, I want to introduce Dr. Tammy Abughnaim. Tammy is an American board-certified emergency physician based in Chicago. She completed her emergency medical residency at Advocate Christ and now works at several community sites. Tammy has been to Gaza twice during the crisis so far as a humanitarian physician and has worked at Al-Aqsa Hospital and Nasser Medical Complex in Gaza. Her work focuses on healthcare delivery in low resource settings, point of care ultrasound, and social justice. And she is a member of the Healthcare Workers for Palestine. So welcome, Dr. Abughnaim, who I will refer to as Tammy.
Thank you so much, Lara. Yeah, I prefer to be called Tammy. Thanks.
Awesome. All right, so welcome, Tammy. And along with Tammy today, we have Dr. Yara Asi, who is probably familiar to people who follow the FMEP podcast and webinars. Dr. Asi is a former fellow with the Foundation for Middle East Peace. We're very proud of that. I will refer to you as Yara, unless you have an objection. Yara is an assistant professor at the University of Central Florida in the School of Global Health Management and Informatics, and she is a visiting scholar at the FXB Center for Health and Human Rights at Harvard University, where she is co-director of the Palestine Program for Health and Human Rights. She is also a non-resident fellow at the Arab Center, Washington, D.C., a 2021 Fulbright U.S. scholar to the West Bank, and of course, a former fellow at FMEP. And I will be sharing in the show notes for this podcast links to previous podcasts and webinars we've done with Yara on the health situation in Gaza, some interviews and articles that feature Tammy, and then some of the research and analysis that has been published or co-authored by Yara since the beginning of the current crisis. So I want to just dig right into it. Again, the topic today is the health apocalypse, which I think for a lot of us who follow this closely, I think one of the concerns is that with all of the crises that are happening, not just Gaza, but Lebanon and Syria, and to some extent West Bank, and I mean the health piece of it, I feel has somewhat fallen off the screen. Those of us who follow this on social media are seeing videos every day and pictures, but as far as the bigger story being told, it's not the story it should be because it's a huge story. So we're going to start with a round for just scene setting. Tammy, I'm going to start with you. And some of this is also just to introduce you to our audience who don't know you. You are an American physician, and I know people are going to be wondering or just making assumptions from your name. So I want to clarify for our audience that you are not Palestinian, you're not of Palestinian descent, you don't have family or links to Gaza, and with that as background, can you talk a little bit about what made you decide to go to Gaza to provide medical care for Palestinians after October 7th, 2023? You've been there twice. I know you hope to go there again. What moved you to do that, particularly given the risk to your safety and the hardships involved? And then relatedly, the bigger context piece, why do we need foreign doctors in Gaza at all?
Yeah, so you're right in that I have no real connections to Palestine, to Gaza. I was actually kind of developing an interest in international health and global health and some of these NGOs who were delivering healthcare in low resource settings, which Gaza, even before October, was. So I was actually scheduled to be in Gaza on October 17th of 2023. And obviously, after the events of October 7th, everything was canceled. What I was supposed to be doing was teaching ultrasound to emergency medicine residents at Nasser Hospital. So I had sort of formed a little bit of a relationship at that point to some of the folks in the Ministry of Health, to some of the healthcare workers that I was going to be working with and training. And it sounds so ironic now, but we were actually going to put together like a mass casualty plan while I was there. How to deal with mass casualties when they come into the hospital. Just a few weeks before we were scheduled to go, there had been kind of shootings. Israelis had shot at Palestinians who were close to the border fence in Gaza, and so there was a concern that this was gonna be something that was gonna happen more frequently, and so we should put together a mass casualty plan, which in retrospect sounds absurd, right? Like, and any kind of mass casualty plan that we would have formed back then would have been, tossed into the trash immediately just because of the scale of this thing. Um, so, I mean, I after we kind of saw the deliberate destruction and targeting of healthcare and hospitals, I really saw myself as being somebody who had a skill set that was in need. I saw how my healthcare coworkers were being targeted in the hospitals, and saw how hundreds of them were dying, were being killed by Israel, and so I really felt a strong sense of duty that, as a healthcare worker, it was my duty to stand by my fellow healthcare workers in Gaza, and that it also, um, if my presence could give them some kind of protection, then I wanted that to be the case. So, to getting to the second part of your question, why is there a need for foreign healthcare workers? The fact of the matter is that Gaza has amazing doctors and nurses. I mean, amazingly well trained, extremely bright, extremely smart, extremely capable. They've been working in conditions of siege for the past 17 years. So, I mean, they need us, technically speaking? No, not really. Like, there is nothing that I can teach anybody in Gaza. Um, what they were really needing was things like supplies, equipment, specialized stuff that the WHO wasn't getting in, or wasn't getting in fast enough. And they really needed, like, presence. They needed bodies. There is an idea in Gaza that the presence of NGOs is a protective factor for some of these hospitals and clinics. And so I was perfectly fine acting as that protective presence if it could be of use to them.
Thank you. I think that's a really important clarification, that last piece. I think there's maybe a perception of Gaza for a lot of people as being this place that, we need foreigners because there aren't doctors. We need workers for X because they don't have expertise. And the point is that there's tremendous expertise, tremendous capacity. It is targeted and deliberately diminished by Israel in this war. And then the idea of doctors coming in essentially to be human shields with their bodies for other doctors is really quite extraordinary. Yara, I want to come to you again, sort of pull the camera back. Back in February of this year, so we're talking like 4 months into this war, you wrote an article in the New York Times, and I'll just say, anytime I mention an article throughout this podcast, just know that I will include a link to that article in the show notes. So don't worry if you didn't get the title of it, you'll be able to catch it in the show notes. So you wrote an article in which you spoke about trauma being experienced by everyone in Gaza, including medical professionals. And the article opens heartbreakingly with this. I'm quoting, "We will die, all of us, hopefully soon enough to stop the suffering that we are living through every single second." Those words were sent in a text last week by a physician working for Doctors Without Borders in the southern Gaza Strip, and it is far from an uncommon feeling shared by those struggling to survive and care for one another in Gaza these days. And again, this was in February of 2024. Can you talk about this, about the reality in Gaza of medical professionals trying to provide vital care for their community, even as they themselves are undergoing the same traumas? Or even, and we're seeing in much of Gaza, the case where they're being specifically targeted. So the same overall traumas, and like journalists, they are specifically a targeted population.
Yeah, thank you, Lara, for starting with this. And to be honest, I could have picked 100 other quotes that are just as harrowing, just as tragic. Um, and as you know, this article came out about 4 months. We're now past 1 year. So as acute as it felt then, we are now to the point where this has been everyday life for people for 16 months at this point, or 15 months. So it's very hard because, we when we talk about healthcare, what we often end up talking about is how many hospitals are functional. And as of the World Health Organization, there's maybe 15 to 17 partially functional at this point. And yes, I mean, you need buildings, you need gauze, you need IV bags. All of that is an important part of a healthcare system. But none of that has any meaning without people, trained people, as Tammy said, that are able to get those tools and use them to serve their populations. Now, what we're seeing in Gaza is a complete destruction of every facet of life. So, aside from healthcare, we're talking about water infrastructure, food infrastructure, sewage and sanitation infrastructure. Obviously, there's no school. There's nothing in life except trying to keep yourself and your loved ones alive. And so, as harrowing as that is for any individual person, a parent or someone taking care of disabled or elderly relatives or whatever, imagine being a healthcare worker in this situation. This is your job. This is your task, and it's existential in a way because you know that you're not just fighting for your life and the life of your patients that are in front of you, but the existential threat to you as a people that is ongoing day to day to day. And I've talked with multiple international physicians who have been in Gaza in the past year, like Tammy, and even in just the 1, 2, 3 weeks that they were there, they are forever changed. What they saw, what they heard, the stories that they told, the people that they couldn't save, the many, many people that they couldn't save, they are haunted by these thoughts, these memories. But at the end of the trip, they get to go home. They get to go somewhere safe. For the healthcare workers in Gaza, that is home. Gaza is home. Many of them have no homes to return to in terms of a structure. Many of them have lost, I would imagine by this point, all of them have lost loved ones, family members, colleagues, friends, former teachers. I mean, basically an entire ecosystem of people. And yet they are still trying to hold on and to keep people alive with the little resources that are still accessible to them. I don't, again, as I was kind of getting to in that article, we don't even have the language to describe what this kind of trauma is. It's 24/7, and you can't even cower in it. You have to stand and work and try to save lives and try to save children and see people in their most vulnerable situation. It's unimaginable. I just want to. This isn't a healthcare workers, but an NGO called the War Child Alliance just did a study of children in Gaza and found that 96% of them feel that their death is imminent. And almost half want to die as a result of the trauma. So these are the surviving children. These are the quote unquote lucky ones. And these are children, we have when we look at these healthcare workers, many of whom are sleeping in hospitals, they're not going home. Um, when this is over, the tales that they will tell, the stories that they will tell, those that have survived, will haunt, I think, all of us forever, and with no end in sight. I keep wanting to talk to people about this in the aftermath, but there has been no aftermath. It's still ongoing, and so this is a really just traumatic from A to Z. It's horrendous.
Yeah, I found myself thinking of two things. One, the videos that most of us who follow this on social media have seen of medical workers, nurses, and doctors going to treat wounded and finding family members. And you watch in real time. It feels almost unbearably intimate to see these moments of just the horror, and then they continue treating people. It also made me reflect on a podcast we did. It must have been close to the beginning of COVID. It was that long ago with a mental health expert from Gaza who was talking about this was then years of siege and everything, basically saying PTSD is the wrong term to use because there's nothing post about it, and that was then. So I feel like we really do lack a vocabulary here that's adequate. So Tammy, I want to come back to you. And I said I'm entitling this podcast something like, the health apocalypse deliberately created by Gaza or by Israel or something like that. I want to talk about this question of the reality on the ground and intent. Because that's often something that's debated. And this goes into the questions of whether it's genocide and whether Israel is violating international law by targeting health facilities, blah, blah, blah. So you've been to Gaza twice since October 7th. You've seen firsthand how things changed across just the time that you were there between those two visits. I want you to talk a little bit about how you saw this situation for health specifically evolve, or perhaps we should say devolve or deteriorate during that time, and specifically on this question of Israel targeting of medical facilities, impeding entry of medical supplies, increasingly impeding access for foreign medical workers, and obstructing evacuation of people for medical care outside of Gaza. So speaking, firsthand here, can you talk about those things?
Yeah, and I mean, as Yara mentioned, there are a million different facets from which you can cover this, and those are kind of some of the most egregious in my mind, ways that Israel has targeted the healthcare system. But yes, I was in Gaza in March of this year, and I was stationed in Al-Aqsa hospital, which is in Deir al-Balah, the middle area of Gaza. Back then, the Rafah border was open, the border with Egypt was open, and that was where our entry and exit was coordinated. Just even kind of letting you know sort of the difference that this one border makes. When we entered in Rafah in March, we were a team of 8 physicians. Um, we carried a total of 42 bags with us. So it was like this giant van that we piled up from Cairo all the way over to the Rafah border. Our bags were inspected, of course. There was, guidance was given to us as to what was allowed in and out. Things like morphine, ketamine, very strong painkillers were off. You could not bring any of those in. But for the most part, you could bring in surgical instruments, other medications. I brought in a lot of like seizure medications, chronic pain medications, that sort of thing. We were able to get all of that in. I personally brought in 5 bags. All of that was allowed in. And so I kind of distributed to the centers over there, to some of the warehouses, and then obviously to the emergency department that I worked in for a couple of weeks. At the time, Al-Aqsa Hospital was and still is kind of the main trauma center of Deir al-Balah. It kind of had to become that. It was never intended to become that. It started as a 200-bed community hospital with, at the beginning, like very minimal resources. And then you compound that with kind of the mass casualties, the Israeli airstrikes that are happening, every few hours. It surged to a 600-bed hospital. There are not enough beds for all 600 of these people, but it also served as a displaced persons camp. And so this hospital, was deemed to be safe enough for people to come and shelter in. Um, at the time, we had a CT scanner that could scan people's heads, and that was about it. You couldn't get a scan of the chest or the abdomen. So if somebody was bleeding on the inside, you wouldn't know about it for 2 or 3 days. Um, Getting surgical treatment was very difficult because there was a backlog of at least 3 days, right? You'd go up to a surgeon and say, "Hey, I think this person needs surgery." And they'd say, "Well, get on the list." Um, Wound care was a daily challenge. There was a system for trying to keep track of patients, but patients moved around so frequently, trying to create like privacy for themselves and create tents inside the hospital wards, that it was very easy to lose track of people. So sometimes we would go days without finding a post-op patient. In the emergency department, we didn't have things as basic as tourniquets. People are coming into us with crush injuries all the time, and we didn't have a way to stop the bleeding. So we used Foley catheters, which are basically large rubber bands, to tie off people's limbs. So that was sort of the situation back in March. As hard as it was to imagine that anything could get worse, when I returned in July, I found that that was, in fact, the case. So, in the interim, in May, Israel occupied and destroyed the Rafah border. And so, the only way for WHO teams to get in became through the Kerem Shalom or the Kerem Abu Salim crossing, which is controlled by Israel. So teams had to go to Amman. They had to cross into the West Bank. From the West Bank, they were taken um, in a large bus that was led by like an Israeli security team all the way over to the Kerem Shalom crossing. Because Israel controls the border, they control what you can bring in. The guidance that we were given is that you are allowed one suitcase, and one backpack, one laptop, one charger, one phone, and none of your bags could contain medical supplies or equipment. And then if you were found to have medical supplies and equipment, it would either be confiscated, you would be sent back, or the entire convoy of 20 plus people would be sent back. And that happened very regularly to WHO convoys in the period between May and when I went in July. Um, Even things like money, they restricted the amount of money that you could bring in. So we were restricted to $2,800. Um, not being able to carry medical equipment as like a doctor who knows that there is going to be nothing for me when I get there, and there has been nothing in these emergency departments, and I know the relief it would bring, it's morally devastating, right? It's like you begin to question what your utility is if you can't bring anything valuable in to the healthcare workers of Gaza. Um, what I was stationed at Nasser Hospital the second time around, and Nasser had been invaded back in February and March, and had only kind of recently reopened in the couple of months before I was stationed there. When the healthcare workers kind of returned to clean up the hospital after the Israeli forces withdrew, they found a mass grave in the courtyard, and this has been really well documented by the healthcare workers over there. There were patients with IVs still in their arms that had been dug into this mass grave, children, healthcare workers. I mean, the workers that I sat with tell me the horrors, and I still have trouble comprehending that this is something that actually happened in real life. Um, so the marks of the Israeli siege and the invasion and the occupation really of Nasser Hospital are still there. I mean, you walk down the hallway and you can see the pock marks of tank shellings. The floor that I stayed on, there's a balcony, and you can kind of see how the balcony was targeted with tank shellings as well. And there's bullet holes. Up on the roof, you can see evidence of Israeli soldiers that were hanging out up there because there are like piles of their food and kind of leftover sunflower seeds and like random things like that. They took the intercom system down. You know, the way that this facility was systematically destroyed, like even small things like, oh yeah, they took down the MRI machine. We found cables hanging out of the walls. Like they attempted to destroy the CT machines. They ripped out ventilators and you know, smashed ultrasound machines. Um, it was very obvious and very intentional, right? And very deliberate. You don't accidentally walk into a hospital and do all of these things. You can't say, "Oh, my bad, like I didn't mean to do that." Like, no, these are very deliberate attempts at destabilizing a healthcare center. Um, I found too that in July and August, the morale of the healthcare workers there had also significantly deteriorated, not just as a, you know, as a product of the condition of the hospital, which in itself was not great, but also there was, you know, after the Rafah border closed, a lot of people began to lose hope that this was something that was going to end anytime soon. You know, back in March, I kept hearing people say, like, yeah, it can't be much longer, right? Like they have literally destroyed everything. Like, what is left? And then they saw kind of the destruction that was unleashed on Rafah and in Khan Yunis, and they saw kind of the entry of Israeli soldiers into their neighborhoods. And this really demoralized a lot of the healthcare workers. And a lot of them will say the same things that you know Yara was talking about. You know, I wish I was dead. The people who die are the ones who don't have to suffer anymore, right? We have to continue to suffer. It's really hard as a healthcare worker to hear other doctors and nurses talking like this because, as Yara mentioned, they're not immune to the conditions that Israel has imposed on the rest of Gaza. They go home to their tents, right? They don't have a house. They're lucky that they're able to come into the hospital, you know, get some clean water and find some shelter and find like a mattress on the floor to sleep on. But at the same time, the journey to and from the hospital is extremely dangerous. At any given time, the bus that they are riding could be hit by an Israeli airstrike. Um, so I mean, the way the deterioration of the healthcare infrastructure is one thing, and then the deterioration of the staff, I think to me is the thing that is really not talked about. That's been kind of buried in the rest of these atrocities and these news stories.
Yeah, thank you for that. I think anybody who's been watching the videos coming out of Kamal Adwan, where the head of the hospital has been basically every day giving reports. It almost feels like at this point I don't mean to be, horribly dramatic here. It almost feels like he's almost resigned himself to going down with the hospital, and he's just giving these reports to try to make the world be accountable. There's something just utterly just gutting with each of those videos, and people who aren't watching them, you really should. I mean, this is part of the obligation to do something, and witnessing is part of that. Yara, I want to come back to you in this question of intentionality. Back in April, there was a peer-reviewed study which looked at the first 2 months just of the Gaza war. You were the lead author on that study. The data showed, in your words, quote, that health, education, water facilities in Gaza were not damaged in a random pattern, but rather that damage was highly clustered on these facilities. So, following up on that report, last month you published a devastating article, and I felt, entitled Intent to Destroy, Documenting a Year of Israel's Attacks on Health in Gaza. I want you to talk about this whole issue of intention. And again, comes up in every argument I have on what's happening in Gaza. Can you talk about the data and how, based on the data, I'm going to keep insisting because data is politically agnostic, it's just data, how it is impossible to conclude anything other than the fact that today's horrendous reality, the health apocalypse, is the result of deliberate Israeli policies that have intentionally created the situation?
Yeah, I'm sure I've had some similar discussions in the past year as well about this question of intentionality, and this is kind of the crux of the genocide argument as well, is what is intention. And we have kind of flattened intention to mean essentially the perpetrator has to basically say, I am intending to do this, right? And obviously most perpetrators of any crime tend to not do that. So it's very strange when for among the most documented crimes in modern history, it's the question is, well, do they really mean it like this? Or, maybe this is all just accidental, or a couple unfortunate incidents, or maybe this is really what it takes for security. It feels quite dystopian. When you go back to that article, and I just want to note, this article just looked at the first, I think, 6 or 8 weeks. So, I mean, long before a lot of the deterioration came, but just in that period, we found that almost 61% of health facilities, 69% of education facilities, and 42% of water facilities sustained infrastructure damage. Further, about a third of health facilities, 40% of education facilities, and 37% of water facilities, I'm rounding up here, were functionally destroyed. So this is in the first 2 months, being generous. Um, Israel has bombed Gaza many times before this. No entity knows Gaza's layout or where the people are better than Israel. Israel has drones, surveillance drones. They have ID, rules to track everybody. And in the past, during the Great March of Return, when Israeli snipers killed and injured hundreds or thousands in Gaza, a military spokesperson said, "We know where every bullet landed." And this was a defense of how, of an effective fighting force, the most moral army in the world, this kind of argument, right? And so if we're going to take them at their word, then we have to assume that everything that they're doing is what they mean to be doing. And so when you look at the totality of destruction of health facilities, what we called critical civilian infrastructure, health, education, water facilities. Um, it seems that this is the intention. And once these initial studies came out, there was not a change in behavior. There was not a um, delineation in like, well, maybe, there was no change whatsoever. The only reason that we're not hearing so much about hospitals being bombed is that, as Tammy said, there's very little left. If you look at drone footage, there's not much left to bomb, and most people are clustered in certain areas. Of course, there are still people in the north and other places. And I think when we also talk about intention, when we look at and Tammy's experience, but also many videos and other documentation of Israeli forces in hospitals deliberately destroying very expensive medical equipment that is very difficult to get into Gaza, requires lots of permits, funding, donors, a lot of permissions. This is not equipment that's easy to get into Gaza, and they're just basically throwing it on the ground, hitting it with hammers. This has nothing to do with security. They're not even pretending this is about security, right? Um, when you look at how many healthcare workers have been killed, more than 500 have been killed as of about this fall, likely much more than that. Just a few weeks ago, we heard that the last orthopedic surgeon in northern Gaza was killed by a drone. In fact, when you look at the dead, many of them are heads of departments, specialists who had to train outside of Gaza and then came back to work in Gaza, medical school deans and professors. So this isn't just the on the ground frontline workers. This is really, if you wanted to completely handicap a health system, these are exactly the types of people that you would target. And it's not like many of them were even killed in hospitals. Many of them were targeted in their homes after their shifts with their families or in those buses or ways that they were getting to the hospital. They were targeted. They were targeted. And we've gotten to the point, I mean, towards the beginning of this, Israel at least attempted to, Al-Shifa was a command and control center. Everyone remembers that CGI thing that Israel had posted on social media. Um, no actual video of any of that, no actual evidence of any of that. In fact, the head of the ICC investigation for Palestine said, and I'm quoting, he was talking specifically about Israel's claim that Palestinian health facilities are being used as military bases, essentially. Quote, I think that has been grossly exaggerated. We need to be able to demonstrate very clearly what the level of military presence was, if at all, in these hospitals, because I think we've been misled about that in the press. And he was referring specifically to IDF statements and quotes. And so the data shows a complete devastation of a healthcare system. I mean, again, take the political layer off. Hospitals, healthcare workers, every aspect of life needed to sustain life has been targeted, destroyed. And then when you couple that, as did occur in the genocide case, with statements by Israeli officials about how they want to resettle Gaza, get the Palestinians out of the occupied territories, not just Gaza, but also the West Bank. They want to claim large swaths of Gaza as quote unquote security zones, buffer zones, or if you listen to the settler leaders, literally make beach houses and condos. And they've already had multiple conventions attended by Israeli ministers. These are not fringe groups. And I'm quite tired of people saying, well, that's just the fringe groups, that's just the right wing. No, these are people in charge with power. And if this was not an acceptable viewpoint in the government, you would think that there would be some repercussions. And there have been absolutely none. None in Israel and none by the U.S. or any outside forces either. So it's Oh, and I want to also quickly touch on the medical evacuations. It's not just the destruction. It's not just the bombing and the raids. There has been significant documentation of the detaining and torture of healthcare workers simply for being in hospitals at the time, many of whom are then released. They were not even charged. There was no even accusation. Their crime was being a doctor or nurse in a Palestinian hospital at the time of a raid. Um, 14,000 people in Gaza right now require medical evacuations for care that they're unable to get in Gaza. And we're not even just talking about trauma cases, amputees, shrapnel wounds, etc. We're talking about children with cancer. There was just a story in the AP, the Associated Press, about a 12-year-old boy who has leukemia. His parents asked the Israeli government 6 times for a permit to get him out. The Israeli government, for security reasons, quote unquote, denied these requests, and the boy has since died of leukemia. That is a death. That is a war-related death. That is not an accidental death. That is not a boy who happened to die of cancer during a war. No, this was a purposeful policy, and this is happening to thousands and thousands of people in Gaza, many of whom are children. So it's the totality of it. It's the entire structure that we're seeing that leads us to believe, along with the data that shows the level of destruction, the level of workers killed, etc., That's what paints the picture. You don't even, I mean, when you look at it all together, there's no aspect of health that Israel has not destroyed, from the social determinants, food, water, education, etc., to even their ability to leave Gaza to get care that they need because they can't get care in Gaza because all the hospitals have been bombed and the workers are being killed. This is not possible without intention, without policy, without top down from the military to the political uh, aspects of Israeli government. This is policy. This is purposeful. It's going to be very clear when we look back on this in a decade or 2 decades or a generation, and it's eternally frustrating that we cannot see it when it's happening right in front of us.
Just to jump in here on Yada's point regarding things like death count, which is often pointed to as like evidence that this is not a genocide, right? Oh, only 44,000 people have been killed. How can you call that a genocide? I mean, when we know in international law, there is no number, right, that constitutes genocide. It is, as Yada said, the intent and the mechanisms that are carried out in which to ethnically cleanse a people or to depopulate. The it's interesting because I was just speaking with a colleague about this death count and what we consider war casualties and what we consider deaths secondary to war. And you have kind of the direct, like people who are killed by Israeli airstrikes, people who are killed in the first few hours after sustaining injuries, people who die as a result of those injuries. And we have seen that that number has stagnated somewhere around 45,000 for several months, right? So even an accurate death toll is not possible. But Yada is right. The conditions that have been brought about by Israel's targeting of like water facilities and hospitals and healthcare centers has led to deaths of, people with cancer, people that have gone undiagnosed, who cannot seek access to a cancer center, who can't get chemotherapy, who were on chemotherapy prior to October and can no longer sustain it because it's not being allowed in. Folks who need dialysis urgently, who die as a result of that. All of those people don't count towards the death toll. Because they are not directly linked to trauma. But as the Lancet article points out, there was a study published in the Lancet several months ago that estimated that the real death toll is somewhere closer to 180,000 to 300,000, if not more. And those are conservative estimates. Just kind of speaking from personal experience, I have seen that, children are dying of things like, the sequela of malnutrition. They're unable to mount an immune response to a simple skin infection. Those children die, right? They're not counted in the death toll. And so that I feel like that is also not discussed as much. Not only are those numbers vilified and their veracity is contested in the press and in the media, but it also it's doing a disservice to people who are interested, one, in the truth, and two, in kind of covering the full dimension and the full scope of what a recovery effort looks like. Um, there, the if somebody who dies of a heart attack as a result of seeing, the horrific crimes that have been unleashed, somebody who becomes so traumatized by the torture that they have endured at Israeli hands just for acting as a nurse at Shifa Hospital or acting as a nurse at Nasser Hospital, who can no longer feed themselves because of their trauma, who kind of wander around and end up um, in a terrible kind of health situation. Those need, and again, we don't have the vocabulary and we don't have the infrastructure to be able to sufficiently describe these things, but those need to be counted if we are interested in actually seeing like what the totality, what the whole toll of this assault on life in Gaza is going to be.
Yeah, I really appreciate you both raising that. I mean, I don't know, for this podcast is being recorded on December 17th, when right now the internet is full of reports of about a new report that came out of a very right-wing pro-Israel think tank. It's a very, I mean, it's not a report that I found remotely convincing, the way people can look at the methodology themselves, essentially discrediting even the very conservative counts that we're getting from the Ministry of Health. And that contrasts with the major report that came out from an organization called Air Wars, looking in far greater depth and coming basically with the conclusion that when you look at the totality of the different ways that people are being killed in this conflict, this war on Gaza, that we're actually seeing a massive undercount. So I'll put links to that into the show notes as well. Yara, did you want to add something?
I did, and Tammy reminded me of this point that you just touched on as well, Lara, which is that another front of this is delegitimization. So if you can't hide what you're doing because there's video, there's evidence, etc., then you discredit the witnesses. So that's why it's Hamas-run Ministry of Health. That's an inherently distrustful entity, of course. So how can we believe their claims, even though they have published literally books of the names, ages, and ID numbers of the dead that they've been able to verify? It is, early on in this, before the evidence was completely, you know, unavoidable, there was, oh, well, this is a doll. This isn't actually a dead child. So it's another front of this to, and I wrote another piece for this on Arab Center to discredit Palestinians and delegitimize any source that attempts to add, because as you said, Lara, data is powerful and it's inherently, well, it should be at least, it is what it is. You can have different conclusions from it, but it is what it is. So when the data speaks for itself, well, what do? You discredit the data. You discredit the data collectors. You discredit the videos. You discredit the numbers. And I remember in the peak of the famine talks in April, when that was actually an issue that the President of the United States seemed to care about, there was an article written by Israeli academics that calculated the number of trucks entering and calculated that actually there was more than enough calories being brought in to feed everyone. And so this talk of famine, so this is not new. This is expected. This is common. And this is another front and should be seen as such. And so I encourage people to look at the Gaza Projections Project, which is an incredibly rigorous, comprehensive project that looks at multiple different factors, multiple different models of time and situation, and shows death tolls and what is most likely. And this is done by mortality experts. These are not I mean, I feel, I don't even like to acknowledge this, but these are not biased folks. These are folks who've done this in Rwanda and done this in other sites of the world. And yet, for some reason, when it comes to Palestinian numbers and Palestinian stories, those are inherently suspicious. And that should be seen as part of the attack as well.
I mean, the fact is basically at this point, the framing is if you're not coming out with news that supports the Israeli narrative, then you are by definition biased against Israel, which means all data is biased, all analysis is biased, unless it is. So that's actually a really good segue to my next question. We're going to run long in this podcast. I'm going to warn people because I want to finish. I've got 2 more rounds of questions, and this is just important. So I'll remind people we're talking here to Dr. Yara Asi, who is a public health expert here in the U.S. We're talking to Tammy Abughnaim, who's a physician, an emergency physician, American based in Chicago, who has twice served in Gaza doing support as a physician there since October 7th. But what you just talked about, the witness, I want to go into this. So Tammy, in early October of this year, the New York Times published an article by another American doctor who served in Gaza. And that doctor had basically talked to a large pool of other physicians and nurses who had served in Gaza to kind of get a cross section of experiences and was writing about that. The article reported, among other things, on doctors seeing repeated incidences of young children shot in the head or chest, widespread malnutrition, which you've talked about, babies dying of malnutrition and dehydration, children suffering from preventable and treatable illnesses. The article and the testimonies it contained was immediately attacked by defenders of Israel, including attacking like the very X-rays, saying the X-rays must have been faked because there's no it was amazing on social media watching. Suddenly everyone became an expert on reading X-rays. I want you to talk about not so much exactly what you saw, but what it is to be a witness, right? So this incredibly, I want to say unusual and non-ideal role of medical professionals like yourself being cast both as health professional and as witness in Gaza. including, by the way, in the context, and you and I talked about this, and if you're comfortable talking about it here, in the context of actually collecting data, like in a way that is usable for holding Israel accountable in front of, for instance, the ICC.
Yeah. I mean, because Israel has restricted aid and restricted humanitarian personnel from entry and restricted independent journalists and restricted forensics experts and weapons experts and really any people that can do the work of verification and can do the work of external reporting. Um, Really physicians and these healthcare workers who are coming in to provide aid kind of have to assume those roles. And it's not a role that we're exactly trained to do. I, as a doctor, never trained to collect ballistic evidence. I was never trained to figure out like where, how to figure out where somebody was, what kind of weaponry was employed, how to take pictures of injuries the correct way, how to photograph CT scans, how to take patient data in a way that was kind of systematic and usable by other people. But this unfortunately became a thing that I had to learn how to do. So after my first mission in March, um, I started to see that, one, Palestinians were not being believed when they were, talking about, hey, we're noticing different injury patterns. We're noticing that there's a different form of shrapnel that's in our patients. It's very hard to extract. It's very hard to treat. Everyone kind of blew this story off, right? Um, saying like, okay, they're exaggerating, it must not be a thing, blah, 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 even though like multiple doctors across multiple hospitals were reporting the same thing. Hey, we're seeing small cubed shrapnel. This is weird. We've never dealt with this before. Um, so I started to see that Palestinians were not being believed. But people like me, who were Americans, who were able to get in and get out, um, were being believed, bringing back kind of our eyewitness testimony. And for whatever reason, there was less scrutiny on us and less disbelief of our narrative. So I could come back and say, hey, I saw a child that had been shot in the head. And although it's incredible to most people, I have no reason to manufacture that, right? I am like the unbiased person in that situation, at least according to the press, right? Um, so that was, I think, the motivation behind Dr. Sidwa, Feroz Sidwa, putting together this New York Times article. And he collected data from all of us. I mean, there is a large group of American doctors and nurses who have been there and come back and who have all reported the same things, the same injury patterns. When we sit around and talk to each other about it, we're all using the same words because, I mean, there's really no other way to describe the number of children that we've seen shot in the head or shot in the chest or anything like that. And it was always similar circumstances. So the way that we identified patterns through this study was very consistent. So when Dr. Sidwa kind of put all of this together and put it through the New York Times editorial staff, they did a rigorous examination of all of this evidence and of all of our pictures and everything that we submitted and CT scans and X-rays and all of that. And yeah, it did come under scrutiny. But ultimately, the New York Times issued a statement, which I mean, they almost never do, just defending the veracity of their work and saying, like, we put in the work, hours and hours and hours of work to validate all of these claims that doctors and nurses are having. But you kind of see that as a humanitarian aid worker, you see that and you see the burden of proof that is so much higher on, somebody who's coming back from Gaza saying like, hey, it's not just like, hey, I saw this and that and that. Well, now you have to prove it too. So I got in touch with forensics experts and I said, hey, how should I be doing this? Like, how can I collect data in a way that's valuable for you all to put in your reports? How can I collect testimonies in a way that maximizes the safety of the person giving the testimony who was a healthcare worker under Israeli torture for a period of time who then returned to work. when I went back in July and August, that's pretty much what I did. Is I stayed in contact with forensics experts while I was there. I had received like a 2-hour crash course training on like turn on the geolocation on your phone for all of your photos and videos, and like, all of those little things that I'm not thinking about, right? Because I've never done this work. And really started the work of not only treating patients but making sure that I was documenting, some of the most egregious crimes that I was seeing. I started very deliberately and systematically documenting the targeting of children, because that was a thing in the press at the time that was really being hotly contested. Was, Israel is not targeting children. That's not a thing that they do. They're the most moral army in the world. Who would do this? Blah blah blah. And then I would come back and say, well, actually, I have proof that Israel is targeting children because I treated a child with a gunshot wound to the thigh. I treated a 19-month-old still in diapers. I treated a boy who had a gunshot wound to the butt. Here is, the picture of that. I treated a child who was a gunshot wound to the chest. He arrived dead. I treated children that were victims of landmines that were left behind by Israeli troops. Like all of these things that I just started to, very systematically and scientifically documenting, that I was really not expecting to do. And it's an unfortunate truth that everybody who now goes into Gaza understands, that a lot of your job becomes less about doing the work of saving lives and more the work of documenting crimes. Um, it's Again, it's not a thing I'm trained for. It's a thing I'm glad I'm able to do, right? I'm willing to do the work, until somebody can be let in that can, kind of take over this work and kind of do it at scale and do it with the rigor that it requires. Um, but it's become part of our responsibilities. I tell everybody who, reaches out to me for advice, like, hey, how did you deal with this? How did you deal with that? I said, your most important job when you go into Gaza is, to do the best you can by the patients that come into your care. That's always the most important job. But the second most important job is to convey what you are seeing, and provide the evidence that your colleagues are supplying you with, and to be the person on the ground who is going to transmit and amplify the voice of your colleagues. Um, Really nothing else matters, right? That what you are able to do on the ground is almost futile at this point. I mean, everybody understands it, that the chances that you're going to be able to really save people, in the way that they deserve to be saved and treat people in the way that they deserve to be treated, has been the chances that you're going to be able to do that are minuscule. Israel has made that almost impossible to take care of anyone within the standard of care that we would expect. Um, but since you can't do that, you can do something else for your colleagues, and you can do something else for your patients, and that is documenting and making sure that at some point there is a paper trail of everything that has happened here. And at some point in time, maybe not even in your lifetime, somebody will be held accountable for all of this.
Yeah, I find myself thinking back that for Palestinians, this story is as familiar as it's as old as time. The idea that unless someone who's not Palestinian witnesses, it didn't happen, and even then, having to prove it, that as even as victim, one is not the victim. Yara, I want to ask you a sort of a mirror image question. Speaking, from your research, from your public speaking, including FMEP podcast, to organizing letters, which you've done. I'll have links to that. Can you talk about your role as a public health expert and researcher, and the work that you and others in your field have been doing since October 7th, 2023, to support Palestinian rights and lives and to defend the medical and humanitarian sector in Gaza?
Sure. I mean, obviously there was no shortage of health challenges across the occupied territories before October 7th, and that's what the crux of my work was before that, looking at movement restrictions and on all of that. At the beginning of the fall of 2023, start of a semester, you have your research agenda laid out for the coming year with my collaborators, and we had all these ideas about what are we going to talk about this year. And then October 7th happens. And suddenly that's everything. That's the only thing that seemingly matters. And so we completely shifted to to from broader questions about settler colonialism and health and more conceptual pieces to we have to document what's happening right now and we have to get it out to as many people as possible. And there's a couple of reasons for that. One, denial is powerful, and there will be a day, and I hope I live to see it, but there will be a day when this is looked at as what it is. And we need to be able to say, everybody knew this evidence was there. This was not a secret. This was not in, Assad's hidden prison chambers, although plenty of evidence got out from there too. This is outside on camera, literally every day. There's not been a day where there has not been something despicable, horrendous, caught on camera, unjustifiable, let's just say. And so, but that's not enough in this world. That's not enough. With all the misinformation out there, with all of the bias that is assumed, especially from someone like me, I am Palestinian. And so I kind of, in some circles, suffer from that, like you're not trustworthy, you're inherently biased kind of thing. And so we have shifted to doing a lot of that, myself and a lot of the people that I work with. To document and to provide evidence. And because, and Tammy, I think you'll agree with me on this, too few of our medical and public health colleagues have prioritized this or consider this part any of their business. This is politics. This is controversial. I'd rather not get into it. I don't know enough about the Middle East, and haven't those people been fighting for centuries anyway? And it's not my business. And so part of why we prioritize publishing in uh, peer-reviewed journals is so that our colleagues can't say that they didn't know, that they didn't have access to data, that they didn't have access to information. And from evidence and documentation, we hope, comes evidence for advocacy efforts, for paths to move forward, for NGOs to advocate, for government actors to advocate, or for forces within governments to advocate. And that's a huge part of what we're doing now. So we're using geospatial data, we're using all forms of different methodologies to capture this from as many viewpoints, perspectives as possible. I also have seen a really important role personally in helping to motivate young people and students to engage in this work, especially through some of my public health organizing. For many various and understandable reasons, a lot of students are very passionate about this, but they fear, if I engage in this, is this a career killer? Will no one want to hire me? Will I not be able to get into grad school or med school or whatever? And so I spend a lot of time these days actually mentoring, you know, young students who want to do this and want to know that it's possible. And I needed that because I'm Palestinian and I have always known about these things, but I did not know that I could do this, that I could be public about it, that I could have a career doing this. And it took people, the previous generation to support, to motivate, to collaborate. And so now myself and a lot of my colleagues are trying to do that because this is going to need all hands on deck, expertise from all disciplines, people, new generations bringing in new ideas, they have mastery of social media and different ways to advocate and organize that we don't understand and we need to tap into. So if we can bring the expertise and documentation and give them some confidence and mentoring, then they can also move forward with this. And I think too, because sometimes, and I don't know a single person who works on this that does not feel, especially at this point, it's been so long that you're kind of screaming into the void a little bit. Like, we've told you everything. There's video of all of it. People burning in their tents, mothers wailing for their children, children wailing for their parents. How much of this do you need to see? And there's a bit of, you feel so powerless. You feel so inept. Like you feel like it's impossible. Like this is a a puzzle that's impossible to crack. There's no solution. And I think a lot of people in times of powerlessness want to look away, and it's a defense mechanism. But I think it's very valuable for me and for many others to just do whatever you can. And it makes you feel like you're doing something. It gives you some of your, it empowers you. It helps you build community with like-minded people. And in this time of such like, cracks in humanity, really, that is really, really valuable. And so all of that together is kind of where I'm spending my time and energy.
That's incredibly inspiring, both of you. I will just add for people who are listening, we haven't really touched on some of the sort of overarching things like it is illegal under international law to target humanitarian facilities, health facilities. I mean, we're talking about the very specific impacts on the ground for health and catastrophe. Standing up to this is something that is an obligation of the international community under international law. It is illegal to mete out collective punishment. You know, there's a certain framework out there which says nothing justified October 7th, but October 7th justifies everything. There's nothing that can justify shooting children. There's nothing that can justify attacking hospitals. That's sort of the fundamental sort of framework here, and the abandonment of that framework is predicated first and foremost on the complete dehumanization of Palestinians in Gaza, right? So that's why we have to fight to even have people understand the stories of what's happening to them as human beings. It's a shame that we have to insist on the humanity of people under this as a starting point to even have a conversation about the policies that are underway. All right, we're in the last round. We've gone long, but we're going to just finish this round because I want to. And this is a looking ahead round. So if people who are getting tired, stay for it. This is a good round. Tammy, I'm going to start with you, and then I'm actually going to come back to you for the last word. I was reading an interview you gave back in August on the margins of the Democratic National Convention, where you were, among other things, you said, quote, "I cannot tell you how disheartening it is to know I'm standing in front of a patient, pulling shrapnel from my patient's body that my tax dollars have paid for." I want you to dig into this idea for a moment. First of all, I want you to talk about what you and other doctors and nurses who served in Gaza were trying to accomplish at the DNC. And second, can you just briefly talk about what you see as the U.S. government's role and responsibility and the taxpayers' implicit responsibility for what we've seen inflicted on Gaza for the past 14 months?
Yeah, I want to preface this by saying I was a very reluctant participant in the DNC events. I had just finished my mission in Gaza 3 days before the DNC. And so my friend Tanya Haj Hassan, who is a pediatric ICU doctor who has worked in Gaza for many, many years before all of this, but we met in March while we were both working at Al-Aqsa Hospital. She's become a very dear friend. She gave me a call and she said, "Hey, I'm going to the DNC. Do you want to come with me?" And I said, "Well, it's in my hometown. I'll see you when you get there, but I'm not touching this." I had become disillusioned as to the utility of pressuring Democratic Party leadership to do anything other than follow the course that they had set out to follow. The doctors that I was with were invited by the Uncommitted movement, which was a small movement of, or actually kind of a good-sized movement of voters who were similarly disillusioned with the Democratic Party and the way that they had been conducting themselves during this assault on Gaza, and kind of the blank check that the United States had been writing to Israel under the Joe Biden administration. And it was essentially saying we are going to break off from the Democratic Party and not vote Democrat, no matter who it is, whether it's Joe Biden or Kamala Harris. We're not going to vote Democrat unless there are significant changes in policy going forward. At the time, what we were really advocating for was an arms embargo. It seemed like kind of the most obvious, easiest first step. Like, hey, you have been unsuccessful in pushing forward a ceasefire. Well, not unsuccessful, I should say. You have not pushed forward a ceasefire.
Or you have
Therefore,
actively blocked a ceasefire?
correct on many occasions. Um, an arms embargo is the best way to ensure compliance with United States law, right? We know the United States can flout international law at will when it serves its own interest, but this is U.S. law, right? And U.S. lawmakers are accountable to U.S. law. U.S. corporations are accountable to U.S. law. So within our own laws, we have protections in place for this sort of thing. So really, what we were saying is, hey. we have shown you how U.S. humanitarian aid is being blocked from entry. And we have shown you how, this is a deliberate practice of Israel is blocking humanitarian aid. And within, within the framework of our law, anybody that obstructs U.S. aid is no longer entitled to U.S. weaponry. So the uncommitted movement was advocating for an arms embargo at the time, and they called up a few doctors who had been to Gaza to come share their experiences in the hopes that it might move democratic leaders to act upon U.S. law and act on their obligations. And of course, it all kind of fell on deaf ears. What we were told by senior Democratic leadership was Kamala Harris is interested in seeming more sympathetic. So the tone will change, right? She will express more sympathy for the victim. She will express, condolences for the suffering of the Palestinian people. But in reality, her practice will be to continue to supply Israel with weapons. So after that, I joined a protest. I did not, we were inside the DNC talking to people and hosting press conferences every single day. And folks like Ilhan Omar and Cori Bush would join us, but then the rest of the DNC, it felt like the Hunger Games, honestly. It felt like you had these DNC representatives who were partying it up, singing the praises of Kamala Harris, and then there were us who were talking about like, hey, this is being increasingly seen as a party that's promoting genocide. Like, this is bad politics, and also like you're going to lose the election off the backs of this genocide. And it of course fell on deaf ears. I think the doctors that were invited all kind of had the same intention, which was if you didn't if you hadn't heard us talk before, this is now a platform for us to get the story out there. Like, yes, this is what we're seeing. We are seeing the deliberate targeting of children. We are seeing the obstruction of United States aid, humanitarian aid in general. We are seeing malnutrition and starvation and all of these things that are being talked about in theory. And so we just kind of wanted to put a face to that. And there was a lot of media interest at the time, particularly, as I said, there was kind of a big media hullabaloo about, whether or not Israel does deliberately target children. And shortly after that is when Dr. Feroz Sidwa came out with his New York Times article. I cannot say it was a great experience. I'm a doctor, not a politician. I don't particularly care for the deliberate obfuscation that politicians use to justify their actions. And so it was a little bit difficult to wrap my mind around how you can see that something is wrong, not only morally, ethically wrong, but also illegal, and then continue on your course after knowing all of that. And I think the cognitive dissonance is very real for a lot of people who work in this space. It's and Ta-Nehisi Coates has talked about this a fair bit. He calls this an American genocide, and I think I would agree with that. Right, this is almost entirely fueled by American weapons, by American money. There was an estimate early on in the first part of 2024 that if the U.S. stopped supplying weapons and arms and money, that this war would be over in like 3 days. So I mean it has kind of become, again, as part of a witness to genocide, as part of a witness to war crimes and atrocities, it becomes your responsibility to speak about that to those in power and to communicate your findings. And so having done that on several occasions, I think I've been to DC like 5 times in the last year doing just that, right? Speaking to congressional reps and staffers and the State Department and USAID about all of our findings, and finding that, for the most part, people know, right? They might not know specifics. Like when I talk about, hey, there is no soap in the hospital, there's a little bit of shock and surprise. Like, what do you mean? We thought we solved this issue. But in general, they know. They know everything that is going on. And this is being conducted with that knowledge. So again, as Yara says, The information is out there. It is very obvious. It is very accessible. Anybody who wants to know about this can. Anyone in a position of power in DC knows what is going on, knows exactly what is going on, and they continue to sign off on aid packages to Israel, and they continue to sign off on weapons transfers to Israel, and then they sanction anybody who does not act in a similar manner. And to my mind, I mean, this is something that is being fueled by my tax dollars, and it is being fueled without my consent, right? Without the consent of a large swath of the American public. Um, so it's been a little bit of a psychological, I don't really know how to describe it. It's been psychologically devastating to understand that I am physically on the ground in Gaza trying to save people's lives, and my government is helping bomb the same people. So as a doctor, I can't really do my job if my government is creating the problem that I'm trying to fix.
Yeah, I'm sorry you have to sit through those meetings. I will say that when I came back from Gaza some years ago, I visited people on the Hill. This is this is almost 8 years ago, I think, at this point. And more or less the message I got when I told people what I saw, and this is after a previous war, was that's terrible, and there's nothing we can do. Hamas, Hamas, Hamas. And it didn't matter who was meting out the misery. The answer was simply there's nothing that we can do because Hamas. And it was like bashing your head against a closed door. Yara, I want to come to you, and again, I sort of want to like take a step back here. The natural question at this point in the podcast is, what next? Where do we go from here? And you said earlier, of course, there's no end in sight, and it's even hard to talk about a day after. But earlier this year, you published an important and challenging article, which people should read, addressing this question entitled Gaza Demands a New Kind of Humanitarian Action. And the subtitle of that piece reads, Aid will not fix Gaza. We need a new definition of humanitarianism that addresses the underlying causes of suffering, occupation, and impunity. So, very briefly, and I do recommend people read the actual article, but can you talk about this idea of getting away from the simple idea of like you ship in aid and that fixes things to what you think is this new definition of humanitarianism that is required?
Yeah, so the reality is I could have written an article with that headline at any point in the past 50 years. It just because the reality of Palestine is a political problem, and it has been treated as one with humanitarian and economic solutions. So let's prop up the PA and send in a bunch of aid, and that's voila, a state, right? Even though that's not how it works. And so when it comes to these acute periods of violence, of which this is not the first, but is certainly the worst, um, that has also typically been the approach. Wait till the bombs stop falling, then send all the approvals and permits and applications to the Israeli government, and let's see what they can let us rebuild. And we'll spend tens of millions or hundreds of millions rebuilding hospitals and re-bringing in, medical equipment and rebuilding roads and yada yada. This is the reality in Palestine. At the same time, the reasons Palestinians need aid are completely ignored. The Israeli occupation, the Israeli blockade, and unending Israeli violence with impunity from all sides, from within Israel and from the external powers who like to talk about human rights and all of these kinds of things. And so the need for aid becomes never ending because you don't deal. Now, if the occupation is lifted and the blockade is lifted and Palestine becomes a sovereign state, does that mean everything's fixed, everything's perfect? Of course not. But that's the starting point. What's been the approach now is aid for quiet. Don't talk about the occupation. Don't push at the international at the international courts of law, at the Security Council, of any of these actual entities that have power to do anything. That's for some reason not the thing to do. The thing to do is to play nice and maybe we'll fund UNRWA this year. Maybe not, Trump pulled it, Biden pulled it. The U.S. is still not funding UNRWA. That's a whole other conversation. But so what's happened is not only has humanitarian aid propped up these structures of occupation and blockade and made them possible, um, but they have replaced conversations about the political realities that need to change in order for this to change. And so that's what I'm trying to get at in this article. Without doubt, Gaza needs a massive and perhaps unprecedented, unparalleled humanitarian response after this. It needs to be essentially entirely rebuilt. Every hospital, every road, and before it can even be rebuilt, just removing the rubble, removing all the unexploded ordnance to make it safe for people, all the toxins that have been released. There are places where that were arable land where that have been bombed. Is it safe to grow crops there? Like this is going to be a multi-decade, generational, multi-billion-dollar effort to rebuild. But every time people ask me about that, I say, well, we're assuming that the territory of Gaza is going to look like it looked on October 6, 2023. Israel has made it very clear that they don't want that to be the case. So the humanitarian and the political are constantly rubbing against each other in ways that I think are no longer can we have these as two separate conversations. Pumping more aid and rebuilding Gaza will be meaningless if it is not coupled with genuine justice, accountability for perpetrators of crimes, the ability of people to return to their homes, whether there's a home there or not, Israel's complete withdrawal from Gaza, and again, the West Bank is a whole other conversation. Aid without those things just means we're going to be doing this again, or this is going to be some essentially colony of Israel and humanitarian agencies that is completely non-functional without massive influxes of aid that we know can, will, and are weaponized. So when the Palestinians misbehave or when they do something that you don't like go to UNESCO or go to the ICC or whatever, that aid that they so desperately need because you have blocked all political resolutions, you just pull it. And then suddenly they're being punished for seeking justice, accountability, etc. So the entire structure of humanitarianism, and I'm not doubting the good intentions of many humanitarians who are working in these, and MSF has been incredible, UNRWA, UNICEF, these many workers that have been going in and out of Gaza to help. We're not talking about that. We're talking about the structure of humanitarianism that has replaced meaningful effort across Palestine. If we do not, if this does not change after what we have seen in the past year, I I honestly don't even know what to say. I don't know what we are doing. And so humanitarianism without a path forward, the purpose of aid should be to end the need for aid, not to stay on aid for generations and generations and generations that can be pulled from your generous benefactor whenever you do something they don't like or whenever there's another global crisis that needs aid. That's not moral, that's not ethical, that's not altruism, that's politics. And so if aid is going to be politics anyway, let's push for political solutions and move forward from this. Give some justice, the entire structure of this needs to change. And I'm unfortunately not super optimistic about that at this moment, but the direction of things and the fact that this is still ongoing. We saw the Amnesty International report of genocide just a few weeks ago, ongoing ICC and ICJ processes. We will see, but a significant change is required, period.
Yeah.
Yada's article is possibly my favorite thing ever written in the New Humanitarian. And I just want to kind of point out that, she does say that traditional humanitarian aid does not end most mass atrocities, which is absolutely true. And then, at the end, you advocate for expanding the definition to include kind of popular political efforts, which I think is super, super important. Because it is, anybody that has worked to bring more awareness to the issue, on the medical front or on the political front, on the student front, the encampments, all of these popular efforts for a ceasefire and for accountability and for, justice, are inherently humanitarian, right? Just because they don't fit neatly into like kind of the big NGO structure of humanitarianism doesn't mean that they're not humanitarian efforts. it's really my favorite kind of thing to point out to people when they ask like, hey, where do we go next? What do we do next? You really have to expand what your thoughts, this framework of humanitarianism is, to include all of that. Like, they are political. Humanitarianism is not an apolitical game, right? They're interconnected, they're intertwined in the most intimate ways. And an understanding of this, and like moving forward, understanding that your work is going to be politicized, but you're going to do it anyway, is kind of that first step.
So Tammy, that was my next question to you to close this up is, at the
Yeah.
natural point in this podcast when people say, so what should people who are hearing all this do? And I think you just answered that really beautifully now. I don't know if there's something you want to add to that.
Yeah, just a couple of things. I think, keeping the focus on Gaza and keeping the focus on the Palestinian narrative in Gaza, is going to be kind of the cornerstone of any kind of path forward. So, there is a lot of fatigue, I feel like, because this has gone on for so long, and it's hard to keep up with the number of atrocities that are happening every single day. And people's attention wanders, and whether that's, as Yara says, a coping mechanism to kind of deal with the atrocities of all of this, or whether it's because other priorities have come up, the first most important thing is to continue to keep the focus on Gaza, to continue to speak about it at every opportunity. That's what I keep doing. I never shut up. In every setting, everywhere I go, I don't care if I'm at a wedding, if I'm at a birthday party, if I'm with my niece, if I'm at a coffee shop, I am talking about Gaza in some way or shape or form outside of my personal experience. I'll say, hey, did you hear about this? So I think keeping that narrative in the public's kind of eye view, in the public's knowledge, is super important. Um, because nobody's going to act if they don't know anything, right? Nobody's going to act if they're not constantly being told that, like, hey, this is what's going on. And the 24/7 news coverage of Gaza has essentially ended, right? A bunch of news networks contacted me a couple weeks ago and said, we're going to end our 24/7 coverage. Mind boggling to me, but fine. So that's one thing. And I think the other thing is, as Yara was saying, you're people who are doing this work, whether that's in academic spaces, student spaces, humanitarian spaces, public health spaces, um, everybody's going to kind of do the work in the way that they know how, with their specific skill set. Um, a lot of people are scared of entering the space and doing the work and advocating for Palestinians in any large way, because they're afraid for their career or their livelihood or their reputation or the blowback or whatever. I think the thing that I've started to emphasize most recently to people is, if you are not comfortable taking that risk, that's fine. For whatever reason, you've done your risk assessment and you figured you can't take that risk. It is now your obligation to protect the people that are taking that risk, right? That is the way in which we kind of create communities around this that allow people to take that risk, to advocate in the ways that they are advocating, whether that's by like physically blockading weapons manufacturers or transport lines, whether that is, kind of physically bird dogging their senators and their legislators, showing up at these events, protesting, getting arrested, all of that kind of thing. Or, in a less physical way, it's the person who is speaking out, who is publishing, who is writing, who's all that, who's dealing with the blowback. If you can't take the risk, it's your job to protect somebody who is taking that risk, and to prop them up and to create systems of support around them, so that we can kind of spread the risk out amongst everybody, and it becomes inherently less risky, much easier to do. And then that's kind of the way that we build mass popular support. In a previous life, I was a grassroots advocate, so a lot of my lens on this is really informed by kind of the grassroots lens, and really just kind of centering the people of Gaza in this movement as much as possible. It's not going to be up to humanitarian aid organizations to figure out how to rebuild the Ministry of Health. The Ministry of Health is going to figure out how to do that, right? They are more than capable. We should absolutely defer to their agency and autonomy, and create conditions in which they're able to exercise it, by making sure that the conditions that existed prior to October 2023 are not being repeated in the same ways, and are not being imposed on them in the same ways.
That was an amazing place to close this out. I'm so grateful. I found myself thinking of one of the things that I've seen that hit me that stuck with me on Facebook, where I've had to unfriend lots of people just because I can't bear to see their inhumanity and racism of so many people that are in my circles. Someone posted a meme. It said, "I'm sorry if my talking about Gaza bothers me. You're not talking about Gaza bothers me." Or which I would now update to, "I'm sorry that my talking about genocide bothers you. You're not talking about genocide bothers me." I think it's an incredibly powerful statement. And I think the point of standing up to whatever extent you can as we enter an era of what is going to be increased repression, efforts at repressing and punishing and chilling people who do speak out, it creates an opportunity for those who maybe don't have the courage and or don't feel able to speak out directly on Gaza, but to defend the right to protest, the right to free speech, to defend the legitimacy of the voices that do. And that's just such a powerful piece of advice, and I appreciate it very much. All right, we've run way over. So for our listeners, I want to thank you and apologize for trespassing on your time, but I could not dare cut either of these brilliant women off. I think this is an incredibly timely and powerful conversation. And I'm honored and so grateful to both Tammy and Yara for sharing their time and experience and expertise with us today. Also, thank you to listeners. And again, apologize for keeping this so long. Hopefully, you listened to maybe it in two parts and took a break. Please make sure to check out the FMEP website, www.fmep.org. There's going to be lots of resources related to this podcast. Everything anybody mentioned will be linked as well. And you can obviously subscribe to this just to keep up to date with our podcasts, iTunes, SoundCloud, and Spotify. And the video will be on our website and on our YouTube channel. Okay, so with that, Tammy, Yara, thank you. And I'm going to go ahead and sign off. I'm Lara Friedman. Until the next episode of Occupied Thoughts.
Thank you for having us.
Thank you.